Good afternoon, everyone. I'd like to welcome back and introduce Dr. Murphy, Executive Director of the Robert J. Havey, MD, Institute for Global Health, and the John Philip Fair Professor of Infectious Diseases here at Northwestern Feinberg School of Medicine, who answers your COVID questions every Tuesday and Thursday here on the Havey Institute for Global Health's Facebook page. And today, Dr. Murphy will be answering viewer-submitted questions that we've received, as well as addressing the latest COVID headlines through today, Thursday, the 6th of January. And we invite you to continue to submit your questions to us via Facebook at NU Institute for Global Health, or directly via email at globalhealthinstitute@northwestern.edu. And leading the discussion again today is our student research assistant, Sophie Buskowski. So Sophie, I now turn it over to you.
Thank you, Kristen. Hi, Dr. Murphy.
Good morning.
Now for some updated COVID statistics. As of yesterday, 62.2% of the population is fully vaccinated. This number has barely gone up for the last month and a half. It probably goes up about 0.2% every single day, which is very little. We are seeing about 704,000 new cases yesterday, with a positivity rate of about 574,000 and a 254% increase over the last 14 days. Hospitalizations are going up 58%, deaths are decreasing by 3%, but unfortunately in Illinois, we're seeing a test rate decrease by 12%, which is a number incredible to note. In Illinois, 64% of the population is fully vaccinated, and we are still seeing a massive increase in cases over the last 14 days. What can you tell us about what we're gonna see for the next couple of weeks with a lot of the numbers I just spewed at you?
Well, the numbers have skyrocketed, astronomically because of Omicron, but also because of the holidays. And during the holidays, we didn't do anything really to stop the spread of COVID, the Omicron variant. There were New Year's Eve celebrations in Times Square in downtown Chicago and many other cities. Whereas many other parts of the world, they canceled all those activities, all those large crowds and whatever. It's just blinders on here. The Chicago public schools started, full-time in person on Monday. There's cases galore among kids. There's now, I think 500 and some children being admitted to the hospital per day in the United States, all different ages. And the kids under 5 are not eligible for vaccines yet. We haven't figured out the dose on that and if it's safe. And the Chicago Teachers Union, I really have to applaud them for, putting their heels in the ground and saying, hey, this is just not, we're just not safe yet. Yes, it is really important that in-person learning in schools takes place. There's no argument. However, is it worth this price? That's the question that you debate. At the peak of a pandemic like this, it's clear to me that it's not worth the price. Now, that could change in 2 weeks. What they try in Europe a lot, and some places in Asia, is they'll put these lockdowns in, or at least, not as strict a lockdown as we had originally, but they'll put closures in place and in-school learning, all that, for a matter of 2 weeks or 4 weeks. Austria is doing it, Denmark is doing it, places in China, they're very strict. But, and that does slow the whole progression of this Omicron variant in the population. So, the United States is just, it's just not doing it. We're putting all our guns in the vaccine basket. And, look, you just read the numbers, Sophie, it's, 1/3 of the people are not vaccinated. 1/3 of 333 million is a lot of people.
Right.
And it's going to continue to spread. We're going to just slosh through this whole thing with lots of people getting sick.
Yeah, definitely. And, speaking of, everything that you just said, the biggest COVID headline that we have is that hospitals are overwhelmed, there's staffing shortages, businesses are closing down, as you mentioned, schools are, also not going back in person. How is this Omicron affecting the United States right now?
So now the data is clear. You can look at it at the state level, you can look at it at the county level. It's really quite dramatic, where you have high vaccination states or counties versus low vaccinations states or counties. There's a huge difference in hospitalizations. I look at our own hospital system. We have a very big system here at Northwestern. I've been told that 90% of the inpatients, and the numbers are rising, are unvaccinated people or not fully vaccinated people. I mean, that is the driver here. You look at the ICU, it's the percentage of unvaccinated is even higher. It's 98 or 99%, I've been told. So it's driven by unvaccinated people. And, you know, they're the ones that are going to suffer the most. I feel so sorry for them. We have a vaccine, several vaccines that can really dampen down the pandemic. There are a lot of breakthrough cases, like everybody says, but they keep people out of the hospital, they keep people out of the ICU, and they keep people alive. It was very good to see recently that the military case, the National Guard case that went up at a higher level in the courts was those states didn't want to mandate vaccines for the National Guard troops was thrown out. So that's like multiple times these kind of mandates have been upheld by the courts. So that's a good thing. How can you have a military with COVID? I mean, you know, George Washington figured this out in 1777 when he mandated smallpox vaccination for the Revolutionary Army. This is nothing new. They didn't want to do it either, but you know, he was the general and kind of running things, and he did it, and so we have to do the same.
Well, you know, you brought up some very interesting points, and as Omicron appears to be less severe, Fauci says that the transmissibility could cause a huge strain on this country. You know, what can you tell us about the spread of Omicron?
Well, it's just everywhere. I mean, there are cases coming out of the woodwork. Look at these numbers. I mean, it's like getting close to 1 million a day. We did have 1 million reported early this week, but that may have just been bunched up from the holiday weekend. But, you know, this is just out of control. We're the outlier in the world. You know, you think we would learn from other countries, we're not. And the messaging has not been clear, and we're confusing a lot of people. And, you know, we have to just really focus on what is really going to help us.
Yeah. And our last, you know, big COVID headline, and one that is incredibly sad, is infants and teens in hospitals. We are seeing, as you mentioned, a huge population of children that are in the ICU. What can you tell us a little bit about some infants and teens with COVID?
Well, I already mentioned that the daily rate, 574 children per day are being admitted with COVID. And some of these kids are very sick, by the way. So it's, you know, at the beginning, very few kids were being admitted. And now, because of this Omicron being so contagious, and perhaps children are more susceptible to getting sick from this thing. This is kind of similar to flu, whereas the people who have trouble with flu are the elderly and immunocompromised and the young kids. You know, it's going to be interesting to see where that goes, but, you know, in the interim, you know, kids are very much at risk.
Yeah.
There's kids reported here in Texas hospital, 4-month-old with COVID having trouble breathing. You know, it's like, this is not good. So we don't want anyone to get infected. And it sort of goes to this kind of comment that's floating around now. Well, you know, it's not that severe. And I think we should just all get it now, because then we're going to increase our herd immunity. Okay, herd immunity is not going to work with this thing, all right? So we already know that when a person gets COVID, that they are immune from getting infected again for about 3 months. Okay, so that's going to help you for 3 months. To get sick for 2 weeks, you're going to get help for 3 months. The vaccines actually give better immunity more consistent and higher levels of immunity than the actual disease. Now, some of the disease, people who get COVID, especially the ones that are really sick, they get great immunologic response if they survive. But most of them, some of them get very little immune protection, particularly if they have kind of a mild case. And a lot of these Omicrons are mild. So in the adults anyway. So it's that's the state of the condition right now. But even if it causes half amount of hospitalizations and ICU admissions in the unvaccinated, if you have 3 times as much infection, you still have more cases than you did before. Right. So it's very simple math, and that's why the hospitals are filling up.
Yeah, definitely. You know, and speaking of hospitals filling up, we have a good COVID question. I'm due for an endoscopy test in the next week at Chicago Hospital. With the rise in COVID cases and hospitalizations, I grow more apprehensive about having an outpatient procedure. My last endoscopy, I was hospitalized overnight due to unexpected abdominal pain. Would it be best to delay until later in January or February?
Now, this person is asking a very realistic question. The governor this week or the end of last week asked the hospitals to halt or slow down on the non-urgent hospital admissions and procedures because the hospitals are getting overwhelmed. I mean, a lot of staff are infected, and you know they don't have the staff to really operate at 100% capacity at this particular point. Many hospitals, some of the smaller hospitals are hurt even worse because they have fewer people employed. This is an endoscopy procedure. This is being done for preventive medicine to identify people at risk for colon cancer or to find colon cancer in people. And it's usually done, it depends on your age and background and everything, every 5 or 10 years. So, you know, you can wait a couple months if you feel okay, but don't wait much longer than that. Try to, you know, get in line. And, you know, like we've talked about all along, we had this huge peak and then there is going to be a drop off. And when things start going down and the hospitals get back to a capacity that they can deal with, you know, get your colonoscopy, but that's not going to be that far away.
Right, definitely. And now for our second COVID question. This individual's husband got Johnson & Johnson vaccine in May and got a Pfizer booster in November. He's 50 with no big health issues. Is he pretty well covered for now, or should he get a second Pfizer shot at some point in the near future?
This person understands what's going to happen. You're going to need another booster shot at some time in the future. We don't know how long those 3 shots in an otherwise healthy person is going to last, because those people are just coming up to that 5-6 month period. You know, they did change the first booster dose from 6 months to 5 months. That kind of snuck in there, and the recommendations recently. Yes, following the Israelis due to 4 months. But anyway, this person's going to need a booster, another booster, a second booster, and at some point. And this person could also take the Moderna. So there's a lot of interesting data about switching the vaccines because they are different. They give a slightly different immunologic response. They're both good. And maybe we should be doing this mix and match. So this is a big question that's out there, but the limited data that are there suggests that switching to the Moderna is a probably good idea. And so that person should consider this when that booster time comes up. So you'll be getting the usual typical confusing messages from the FDA and the CDC and the director of the CDC and the director of the FDA, all, you know, you get it minute by minute. Real time sometimes is very painful. You know, I don't know why they don't streamline this whole process. You know, you can get people, we have rooms and we have videos where they can present all this stuff to one group and make a decision, but they don't do it that way. So anyway, but yeah, at some point, you're gonna need a booster, another booster.
Now for our third COVID question, is it safe to fly, Dr. Murphy? This individual's family had a trip planned for late January, but now with the variant, they are thinking twice about getting on a plane. They are both vaccinated and boosted with J&J and Moderna, but one member of the family is 80 years old with diabetes. They plan on wearing N95s in the airport on the plane. Is this trip too risky?
Very simple answer. Yes, it's too risky. This is not a time anybody should be doing non-essential travel. sorry, airlines, you're going to make it up later because people are going. This is going to be the Roaring 20s are going to happen as soon as we get this thing under control. But yeah, right now, non-essential travel. This sounds like it's non-essential travel. Sounds like it's for fun. That would be great. The story might be a little different if it was totally vaccinated, boosted people in their 20s up to 50, or even in the 50s, N95 masks, which are the best masks. There is a way to do this for some people, but you throw in 80-year-old mother here with diabetes. This is the kind of woman, even with the boosting and stuff, that could end up in the hospital. And it could be quite critical. So it's just too risky at this particular point. Being on the airplane itself, if you have the mask on, there is some risk because of the aerosolization. Being in the airport, getting to the airport, are you driving there? Are you taking the train? Are you taking a taxi or Uber or something? All that stuff comes into play. Then when you get there, you're in crowds of people. And the United States, of course, does not mandate vaccines for people who are flying. So the airport is full of unvaccinated people. So high-risk people spreading this around, masks are good, but they're not 100%. It's just too risky at this particular point. And you throw in the 80-year-old diabetic, and that's just not a good idea right now, today.
No, absolutely. And our fourth COVID question. They've been wondering for months how much it costs to get COVID in the hospitals. What can you tell us about the price to get COVID, Dr. Murphy?
The whole medical system in the United States is a tortuous amalgamation of pricing and insurance. There's 1,600 different insurance companies, and there's multiple plans within each company. And then you have Medicare, you have Medicaid, and you got no pays. You got people with no insurance. There's prices all over the board. I mean, hospitals hate showing the prices because probably nobody in the hospital is paying the exact same price. I mean, or very few people are paying. What is the cost of this thing? So, groups like the Veterans Administration, where there's no cost to the people, they know how much it costs. People like the Kaiser Foundation, the Kaiser Permanente Medical Group, not the foundation, the medical group. They have this huge, take care of millions of people in their practice plan. They know how much it costs. Medicare knows how they're paying so much of the bill. Medicare knows how much it costs. And they figured out a very fair way. And guess what? The hospitals love Medicare. You got Medicare, hey, everything works. You look here at these numbers, the average Medicare Advantage coverage averaged $21,400 for a hospital admission. Now, if you had private insurance, it was $42,200. What gives here? It's the same care. It's the same kind of people, same disease. It's just, I don't know. It's just this crazy Byzantine billing system. It's the way we've supported it. So anyway, it's really hard to say how much it costs, but it's somewhere between $21,400 and $42,200, and then Medicaid pays a fraction of that. So it probably Medicaid doesn't even pay what it really costs. So, but at least it gives the hospital something. So that it's not just a big zero there. And the worst thing, the other number that's missing here is, what about the person that walks off the street with no insurance, and they get what they call the rack rate. That's like if you walk into a hotel and say, hey, do you have a room available? Right. Sure, we got a room available. It's $380 a night. There's nobody in the hotel paying $380 a night, but you just walked into here in US, that's what the rack rate is. So those people really get a raw deal. Yeah. And then of course, they're usually they have no insurance because they don't have the money.
Right.
They don't have access to the insurance, so they can't afford it, or something is wrong. And then when they can't pay, they end up in court with, big, it's a crazy system that we have. So it's very hard to answer that question based on the system that we have.
Right. And well, for our last COVID question, this individual is immunocompromised and has a 2-year-old daughter who is at high risk with kidney disease. My question is, now that the FDA and CDC is recommending boosters at 5 months, those of us who have received a booster in late August due to being immunocompromised would be the 5-month mark at the end of this month. Are we supposed to get a 4th booster shot since our 3rd brought us to the level of non-immunocompromised 2-shot recipient? There's little discussion on this, and that is very true. What can you tell us about the 4th shot, Dr. Murphy, and the immunocompromised group?
Yeah, I mean, immunocompromised can get a 4th shot. But also, again, look at what we talked about a little bit already. Look at the Israelis. They've already approved the 4th shot for anybody over 60, healthcare workers, and anybody immunocompromised. That's already started. And they show that they get almost immediate, it's like within a week, 5-fold increase in their antibody titers. Now remember, antibody titers are only one part of the whole immunologic response to the vaccine. But it's a marker and it's easy to measure. So we look at that quite a bit. So, yeah, you're going to need, these people need even more boosters, and they'll be approved before anybody else.
Wonderful. Well, those were all of our COVID questions.
If you want to move to Tel Aviv.
No, absolutely.
You can sign up, you can get it when you get off the airplane. But,
no, absolutely. Well, those were all of our COVID questions for today. Thank you, Dr. Murphy.
Okay. Have a great weekend.